Good afternoon, everyone. The topic is very interesting, precision nutrition in reproductive medicine. So, what is precision nutrition? So far we have been having fixed dose combinations which are prescribed randomly to all patients who come to us with infertility, regardless of their comorbidities or whatever may be the reason for oligospermia, astenospermia, teratozoospermia. We have, it's like a fixed dose thing and we prescribe that. But now has come precision nutrition where, depending upon the exact need and what is the problem, targeted problem and targeted micronutrient which will be the best for that condition. A new name to antioxidants. So we know that both male and female factors are equally contributed. The definitive role of oxidative stress, hormonal imbalance and micronutrient deficiencies, we all know, we are aware of it. So focus on precision nutrition for reproductive health. What is precision nutrition? It is a tailored nutritional intervention based on individual profiles. It addresses specific deficiencies, metabolic needs, and their reproductive goals. So a targeted supplementation is given rather than a fixed dose combination for better outcomes, which is synergistic with lifestyle and medical fertility treatments. I put in this slide because this is something very new for all of us. Things like nutrigenetic test, predictive biochemical analysis, gut microbiota test, and use of clinical software. So actually, now they are trying to correlate. We all know of gut dysbiosis. We all are aware of chronic inflammation being the basic inherent reason for not only infertility, multiple disorders. So there are tests now which are still, I think, in the infancy stage, but they are going to come up very soon. So we have these patterns, macronutrients, micronutrients, and also bioactive compounds. So the role of precision nutrition is to improve, in a male, of course, would be to improve the sperm count, the motility, and the morphology. How? By combating oxidative stress, correcting the mitochondrial dysfunction, and correcting the hormonal imbalance. So let us talk about oats, or oligoastenoterazoospermia. It is a combination of 3 sperm abnormalities. Oligozoospermia is low sperm count, asteноzoospermia is poor sperm motility, and teratozoospermia is abnormal sperm morphology. So till now, we all had just one particular molecule which had a combination of macronutrients, micronutrients, antioxidants, and that would be prescribed. What is the management for oats? Hormonal agents like testosterone, use of anti-estrogen like clomiphene, aromatase inhibitors, and GnRH analogs. Antioxidants, glutathione is coming up in a big way in the cosmetic field. Lycopene, vitamin E, and acetylcysteine. Sperm vitalizers like L-carnitine, CoQ10, and myoinositol. Myoinositol is the new kid in the block. Nutritional supplements, zinc, folic acid, selenium, B12 we have been using, and then indomethacin and L-arginine. What are sperm vitalizers? We all know that when we get a semen analysis done, sperm vitality is mentioned. What is that? It is the percentage of live sperms present in the given sample. And as per WHO, the reference value range is between 54 to 97%. So what does a sperm vitality mean? It indicates proportion of sperm cells with intact membrane, meaning they are alive and potentially capable of fertilizing an egg, irrespective of whether they are motile or not. Let's start with the sperm vitalizers. L-carnitine. It is naturally found in the epididymis, helps in sperm maturity. It transports fatty acids into the mitochondria, so boosting energy for sperm motility. Clinical trials have shown that 600 milligram of L-carnitine can improve motility and count, often combined with N-acetylcysteine for better absorption. Side effects are few. It is safe for long-term use, however, under supervision. CoQ10 we have been using for so many years now. It is the sperm's energy spark plug. It is a key mitochondrial enzyme. Sperms are energy-hungry cells, and CoQ10 acts as an antioxidant and energy carrier in the sperm mitochondria. 200 to 300 milligrams of CoQ10 every day, per day, can improve the sperm motility as well as density. CoQ10 levels are lower in men with idiopathic infertility, also improves the morphology and the DNA integrity. Now, is there a role? I just talked about giving tailor-made treatment for male infertility. So let us have a small talk about men with diabetes and male infertility. So far, we all knew that men with diabetes have sexual dysfunctions, they have ED, and they have decreased libido, retrograde ejaculation. But besides that, does diabetes have a role to play on the sperm quality? Yes. The motility, increased sperm DNA fragmentation, lower sperm concentration, total count compared to non-diabetic men has been found. There is a negative effect on the male fertility. Diabetes has a negative effect on almost all of the sperm parameters. And this negative effect of the diabetes on male fertility are because of the alteration in the testicular environment, testosterone homeostasis, ejaculatory function, and libido. Again, how metabolic syndrome. So just besides diabetes, let us talk about a broader perspective, metabolic syndrome and male infertility. Is there a correlation? Yes. Again, impact on the sperm quality, hormonal imbalance, and oxidative stress, reducing the sperm function and leading to sperm DNA damage. There is chronic inflammation, I already mentioned, insulin resistance, and lifestyle factors, unhealthy diet, lack of exercise. These are common in individuals with metabolic syndrome. We all know about that. Further exacerbating the negative effect on the male fertility. So here comes the role of minoxidil. So far, we've known minoxidil as an insulin sensitizer used in women with PCOD. We generally prescribe minoxidil 3 months prior to starting them on ovulation induction, or otherwise a young girl who has irregular periods and obesity, minoxidil is given just randomly. But does it have a role to play in male infertility? Yes, with diabetes. It increases the sperm concentration count, improves the motility, enhances the acrosome reaction, reduces the DNA fragmentation, positive impact on the mitochondrial function. It has antioxidant properties, regulation of seminal fluid osmolarity, improves the testosterone levels. So minoxidil improves the insulin sensitivity, so it helps in metabolic-related infertility. It also acts on the calcium signaling inside the sperm, which is crucial for motility. Studies have shown that minoxidil can improve sperm motility and concentration. Usually 2 to 4 grams is what we prescribe. It may benefit men with obesity and metabolic syndrome, which is linked to infertility. N-acetylcysteine, it is a master detoxifier. It is a precursor of glutathione, the body's main antioxidant. It reduces the reactive oxygen species of the semen, and a dose of 600 to 1200 milligrams per day improves the semen count and motility. It also reduces the sperm DNA fragmentation, may benefit men with varicocele-related oxidative stress. Again, the benefits of NAC on sperm parameters, concentration is improved, volume is improved, motility, better morphology, DNA fragmentation is reduced. Dr. Aruna will be talking about DNA fragmentation. And coming to DHEA. Now, all of us have been prescribing DHA in women with low MH counts, where the reserve is very poor. Usual dose is around 75 milligrams, associated with, along with vitamin D, folic acid, and melatonin. Does it have a role to play for male infertility? Controversial, but promising. It is an androgen precursor, we know that. Some men with low DHEA levels have low testosterone, poor sperm production. And small studies have shown that DHEA may improve sperm count in select cases of hypoandrogenism. Not routinely used, must be supervised, excess can disrupt the hormones. Used more in research, precision testing is needed before supplementation. So in a nutshell, we have so many micronutrients, macronutrients, antioxidants. With L-carnitine, there is a decrease in the DNA fragmentation and improvement in the sperm motility. Minoxidil also improves the sperm parameters and serum reproductive hormones in patients with idiopathic infertility. CoQ10, improvement in the sperm density, motility, and morphology. N-acetylcysteine supplementation leads to increase in the sperm concentration. DHEAS has an important role in the diagnosis and follow-up of male infertility. But please be careful. You must be sure of whether these are really needed or not. Precision nutrition is a valuable adjunct in fertility care. This is what is individualized or tailor-made treatment. It is not bracketed like all men with fertility issues would be prescribed a common medicine. So an individualized approach for a better reproductive outcome. The future is in nutrigenomics and personalized supplementation, integration with ART and lifestyle for holistic fertility management. And they work best in men with idiopathic infertility, those with oxidative stress, or those with metabolic stress. Random use, I repeat, is not recommended, only after testing and personalization. Thank you.